Hello friends, welcome back. You or your dear and near ones are COVID positive. And in this Omicron wave, it is expected that most of the infected people are Omicron positive. What to do now? Let's understand when home isolation is okay and when we need to seek medical help. At the end of the video, you will hear about the symptoms from people of different ages who are Omicron positive. If this seems interesting, watch until the end. Home isolation is recommended for people who are asymptomatic or have mild symptoms. By asymptomatic, we mean laboratory confirmed COVID positive but not experiencing any symptoms, and oxygen saturation at room air is more than 93%. And by mild symptoms, it means COVID positive, of course, upper respiratory tract symptoms with or without fever, no shortness of breath, and oxygen saturation is more than 93% at room air. So, what are you supposed to do? First of all, isolate the patient, preferably with a personal bathroom. Room should have good ventilation where fresh air can come in freely. Patients should wear triple layer medical mask like surgical mask or N95. Patients should take rest and drink lot of fluid and remain hydrated. Fruits and vitamin C is also recommended. Cover your mouth with tissue while coughing or sneezing. Patients should wash hands with soap and water for at least 40 seconds or clean with alcohol-based sanitizer. When one is at home isolation, self-monitoring is very important. Make a self-monitoring chart with date and time. Monitor your temperature, heart rate. You can find your heart rate from the pulse oximeter. Oxygen percentage also from the pulse oximeter. How you are feeling. What about your breathing status? Now let's talk about some simple treatment options for mild or asymptomatic patients who are at home isolation. Always communicate with your medical officer and promptly report if your conditions worsen. If you have comorbidities or any kind of illness, don't stop the medications without doctor's permission. As I told earlier, proper self-monitoring record must be kept. Patients can perform warm water gargle or take steam inhalation thrice a day. If fever is not controlled with maximum dose of paracetamol, that is 650 mg 4 times a day, immediately consult your treating doctor. At no point you should do self-medication. Patients may utilize teleconsultation platform in their state or district. There is a teleconsultation platform eSanjeevani. Now let's talk about certain don'ts during home isolation. Do not perform self-medication as I told before. Blood investigation, radiological imaging like X-ray or chest scan without consultation of medical officer should not be performed. Steroids should not be taken without doctor's permission. Overuse and not using steroid at the correct time can lead to additional complication. So steroids are big no-no without doctor's permission. You are at home isolation. Either you will recover or your condition will worsen. Let's see when you should seek medical help. If one has unresolved high-grade temperature more than 100 degree Fahrenheit for more than 3 days, you should seek medical help. Difficulty in breathing, dip in oxygen saturation that is less than 93% at room air, at least 3 readings within 1 hour, respiratory rate more than 24 in a minute. To monitor breathing or respiratory rate, sit in a position and count the number of times you are breathing in 1 minute. Persistent pain or pressure in the chest, mental confusion or inability to stay awake, severe fatigue and muscle pain. So in these conditions, you should seek medical help. Let's talk about the other condition when you are recovering. So when to end self-isolation? If 7 days has passed from the time one has tested positive and there is no fever for 3 successive days, then you can end your self-isolation. But you should continue wearing masks and follow other COVID norms. According to the Ministry of Health, there is no need to retest after home isolation period is over. Hope this information will help you during emergency. Now let's hear the experience of some patients who were COVID positive, most probably with Omicron.
আমি একজন 70 বয়স্কা ভদ্রমহিলা। আমার দুটো কোশিল্ড ভ্যাকসিন দুটো ডোজই হয়ে গেছে। তারপরে এখন আমার 3-4 দিন আগে একটু জ্বর হয়। প্যারাসিটামল খেয়ে জ্বরটা কমে যায়। পরের দিনেও একটুখানি জ্বর ছিল, গা হাত পা ব্যথা। কিছু ওষুধ খাই, ওষুধের পরে এখন মোটামুটি সব কিছু ঠিক আছে। কিন্তু সকালের দিকে একটু নাকে পাতলা জল সর্দি আসছে, আর নাকটা মাঝে মাঝে বন্ধ হয়ে যাচ্ছে। শরীরে আমার কোনো দুর্বলতা, কোনো অস্থিরতা, কোনো খাওয়ার অরুচি এসব কিছু নেই। মোটামুটি বলা যায় আমি এমনিতে সুস্থই আছি। একমাত্র অসুবিধে হচ্ছে মাঝে মাঝে নাকটা বন্ধ হয়ে যাচ্ছে। আজ 4 দিন হচ্ছে, 3 থেকে 4 দিন আজ হচ্ছে।
Hi, male aged 48 years. I am detected COVID-19 positive through RT-PCR test on 6th of January 2022. Previously, I had COVID in December 2020, then completed my double dose vaccination in May 2021. I took 2 shots of Covishield. I have high blood pressure and take medicines regularly. This time, the symptoms started with itchy throat and wheezing. I was feeling cold also, though not shivering. There was no fever, little bit of tiredness and dizziness I could feel. Wheezing is there off and on. With the onset of symptoms, I consulted a doctor on 5th of January and now being treated under his supervision.
নমস্কার, আমার বয়স 43। আমি ওমিক্রনে আক্রান্ত হয়েছি। আমি ভ্যাকসিনের ডাবল ডোজ নিয়েছি, কোভিশিল্ড। আর কোভিড মানেই তো ভয়, কোভিড তো মানুষের ভেতরে ভয় জাগিয়েছে। জিনিসটাকে আমি খুব একটা যে একদমই সাধারণভাবে নিইনি। যখনই প্রথম দিনই যখন গলা খুসখুস হয়েছে, গলা খুসখুস হালকা কাশি, আমি ডক্টর কনসাল্ট করেছি। ডক্টর যেভাবে নিয়মিত ওষুধ দিয়েছেন আমি ওষুধ নিয়মিত নিয়েছি। আমার ডে 2তেও গলা খুসখুস সর্দি ছিল, তবে আমার ডে 1 থেকে আমার জ্বর আসেনি, জ্বর ছিল না। আর এটা একদম সাধারণ সর্দি কাশির মতোই। ডক্টরের কনসাল্ট নিয়ে মেডিসিন খেয়ে ঘরে বসেই এটার সাথে লড়াই করা যাচ্ছে এখনো পর্যন্ত। আজ ডে 6 আমার। আমি সুস্থ আছি, ভালো আছি, আমার কাশি নেই, এখন সর্দিও নেই। মোটামুটি আমি এখন একদমই ফিট। তাই বলবো ওমিক্রনকে ভয় পাবেন না, ঘরে বসেই লড়াই করা যাবে, তবে অবশ্যই বিশেষজ্ঞদের মতামত নিয়ে।
Hello, I have recently recovered from COVID's new variant Omicron. My age is 18 years and I am double vaccinated with Covaxin. Some of the symptoms which I had are such as headache, runny nose, throat itching, and coughing. The first day of the effect started with coughing, headache, and runny nose. On the second day, I had throat itching from the morning itself. In the evening, I visited a doctor, took medicines prescribed by him. On the third day, I started taking the medicines and I also started recovering. On the fourth day, I got fully recovered. I would like to say that the new variant Omicron is not so harmful like the previous variants. It can be treated at home itself with proper medicines prescribed by the doctor.
So as you can see, all of them were in home isolation, none of them required hospitalization. All of them had mild symptoms and they were fully vaccinated. 3 of them had COVID infection before. There might be various reasons for this milder symptoms. Firstly, Omicron variant itself has become less deadly. That is the reason the symptoms are milder. Secondly, due to vaccination or previous infection, we know that even after full vaccination or previous infection, antibodies are not working, but T cells are imparting protection. Both vaccination and previous infection will produce T cells which will fight against Omicron. So you can understand that vaccination works and it is very important, and please follow COVID norms so that you can protect yourself and your dear and near ones. In my previous video also we have seen that vaccinated people are developing milder symptoms against Omicron. So vaccination is very important, and please follow COVID norms so that you can protect yourself and your dear and near ones.